Hey everyone, and welcome. Today we're going to talk about a totally different way to think about our health. It's a real shift, moving away from just fixing problems as they pop up, and instead getting into the world of proactive wellness.
When you really break it down, there are two main paths in healthcare. On one side, you've got what we call reactive care. This is probably what you're most familiar with. You feel sick, you see a doctor, you get a treatment. The entire focus is on the symptoms. But then, there's this other approach, preventative care. And this is a complete game changer. The focus here is all about maintaining your health and actively making a plan to stay well. It's about playing offense, not defense.
So let's really dig in and define what we actually mean by preventative care. This is all about changing our mindset, shifting from just treating sickness to actively pursuing wellness.
Okay, so here's the official breakdown. Preventive care is all about one thing: stopping illness before it even gets a chance to start. It works in three key ways. First, by identifying your personal health risks. Second, by promoting healthy habits you can do every single day. And third, by using early detection, things like screenings. Just think of it like having a forward-looking strategy for your own body.
And believe me, this isn't just some abstract idea. It gets right to the heart of some of the biggest health challenges out there. We're talking about getting ahead of things like heart disease and diabetes, managing your weight and metabolic health, and, this is so important, focusing on stress, sleep, and emotional well-being. These are the real cornerstones of a healthy life. Of course, it also includes things like vaccinations and cancer screenings, making sure you're protected now and you know your risks for the future.
So this all sounds pretty good, right? But it does bring up a really common question. Who is this actually for? Is it something just for people who are already dealing with a health issue?
Let's just ask it straight up. Is this something you only need to worry about if you're already sick?
The answer could not be more clear. Nope. It is absolutely for everyone. It doesn't matter if you feel like you're in perfect health or if you're already managing a chronic condition. A preventative approach has something really valuable to offer you.
So how do you know if it's for you? Well, you should definitely think about it if you have a family history of something like heart disease. Or maybe you just want some solid professional advice on your diet, exercise, or sleep habits. Even if you feel fantastic right now, a proactive health check can give you an incredibly valuable picture of where you stand. And hey, if you are already managing a condition, this is the key to preventing it from getting worse.
Okay, so we've covered the what and the who, but what does preventative care actually look like when you put it into practice? Like, what really happens? Well, it's actually a pretty structured process. It all kicks off with a really deep dive, a full assessment of your medical history, your family risks, and your current lifestyle. From there, you move into personalized coaching. And I mean personalized. This is not generic one-size-fits-all advice. Step 3 is where the screenings come in, to check for hidden risks. And finally, and this part is absolutely crucial, it's all about continuous support, creating a real long-term plan to keep you on a healthy track.
And all of that support, all of that coaching, it's all built on the foundation of these 5 core actions. We're talking about a cycle of balanced nutrition, staying active, getting proper sleep, keeping stress in check, and of course, staying on top of those timely screenings. These pillars are really what make the whole thing work.
This brings us to what I think is the most exciting part of this whole idea. This approach, it's all about empowerment. It's about putting you in the driver's seat. It really makes you the CEO of your own wellness journey.
And here's why that is so incredibly powerful. Those early lifestyle changes, the things we just talked about, can often help you manage or, get this, even reverse certain conditions before you ever need to start taking medication. I mean, think about that. That is an amazing amount of control to have over your own health in the long run.
So what's the big takeaway here? It all comes back to this one simple but really profound idea. Prevention begins with knowledge. Just understanding your body, knowing your risks, and being aware of your choices, that is the true first step toward a stronger, healthier you.
So I'll leave you with this to think about. After all of this, what is one proactive choice, just one small thing, you can do for your health this week? Thanks so much for tuning in.